How do mast cells cause hay fever in children? Imagine your child's nose suddenly starts to itch, they're sneezing nonstop, and their eyes are watering like they just watched a sad movie. These are classic signs of hay fever, also called allergic rhinitis, which is very common in children. But have you ever wondered what actually causes these uncomfortable symptoms? The answer lies in tiny cells in the immune system called mast cells. Mast cells are special white blood cells found all over the body, especially in places exposed to the outside world like the nose, eyes, and lungs. Their job is to act as sentinels, ready to respond if they detect something harmful like a virus or bacteria. But in children with allergies, mast cells can mistakenly see harmless things like pollen, dust mites, or pet dander as threats. This mistake triggers a chain reaction that leads to allergy symptoms. When a child with a tendency to develop allergies encounters an allergen for the first time, their immune system reacts by producing a special antibody called immunoglobulin E, or these Ig antibodies attach themselves to the surface of mast cells, marking them for future encounters with the same allergen. Think of it like leaving a note on the mast cell saying, "This is a threat." Later, when the child is exposed again to the same allergen, the allergen binds to the Ig antibodies on the mast cells. This binding activates the mast cells, causing them to release chemicals stored inside them. The most well-known of these chemicals is histamine, but others like leukotrienes and prostaglandins are also released. This process is called degranulation. The released chemicals cause blood vessels in the nose and eyes to widen and become more leaky. This leads to swelling, redness, and increased mucus production. That's why children with hay fever often sneeze, have a runny or stuffy nose, and their eyes become itchy and watery. These symptoms usually appear within minutes after exposure to the allergen, which is why they're called immediate or early phase reactions. Sometimes, symptoms can continue or worsen hours later. This is called the late phase response, where other immune cells like eosinophils and T cells are recruited to the area. They contribute to ongoing inflammation, making symptoms last longer and sometimes causing more discomfort. It's important to know that not all allergic reactions are caused by Ig and mast cells. Some children might have conditions like mast cell activation syndrome, where mast cells releases chemicals in response to various triggers, not just allergens. But in typical hay fever, the process we've described is the main cause. The severity of symptoms can vary from child to child. Some might only have mild sneezing and a little runny nose, while others might have symptoms that interfere with sleep, school, and daily activities. Factors like genetics, how much allergen they're exposed to, and overall health can influence how bad their hay fever gets. Managing hay fever usually involves avoiding known allergens as much as possible, using medications like antihistamines to block histamine's effects, and sometimes nasal sprays called corticosteroids to reduce inflammation. For some children, allergy shots or tablets called immunotherapy can help their immune system become less sensitive over time. Since hay fever is a long-term condition, working with healthcare professionals to create a personalized plan is very important. This helps control symptoms effectively and keeps children feeling better. In summary, mast cells cause hay fever in children by releasing chemicals like histamine when they encounter allergens, leading to sneezing, itching, and nasal congestion. Understanding this process helps us find the best ways to treat and manage allergic rhinitis, so children can enjoy their days more comfortably. Always consult a healthcare provider for advice tailored to your child's specific needs.